you guys. So good to see you. Hope you're having an awesome day. I wanted to tune in right now and dive into a topic it's pretty hot and heavy right now, and I think it has been for a very long time. But because obviously, if you are searching out and watching this, you're interested in finding some natural alternatives to pain. So a specific type of pain that we're going to talk about today is fibromyalgia or fibro. So, even though it's very common, so I hope that you guys are going to share this, so that if it's not you that's suffering from fibro, that you are sharing it with others, right, and empowering others, and letting them know that it's not something that you just have to live with. Okay, fibromyalgia is actually the second most common condition affecting your bones and your muscles, and it's so often misdiagnosed and misunderstood. Okay, so I want to take a really deep dive into this, and before I can really do that, I want to debunk some myths again, because there's always, when it comes to our health, there's always some certain things that you hear people say that, or even health practitioners say, that has actually been really discredited. And I don't want you to think that this is something you have to live with, if in fact you kind of fall into the category of one of these myths. So the first myth that you might hear is that it's all in your head. And I'm so sorry if any of you have experienced this really harmful myth. There is so many things and so many disorders, I guess, that we could have that are in our head. Fibro is not one of them. I want to acknowledge that your pain is real. And I understand that it's very real, okay? And many doctors still don't understand this condition, which is leading them to conclude that some of the pain is just in your head, right? We're constantly learning more, right? And when we know better, we do better, right? So just keep knowing that that's an absolute myth. Myth number two, fibro is a catch-all diagnosis, okay? I feel like IBS is a catch-all diagnosis where, when you can't explain, what is happening with people's guts, right? That's kind of just the catch-all. Oh, you're irritated bowel, right? Fibro isn't one of those things. Fibro is a specific diagnostic criteria, which is, it's actually developed with the College of Rheumatology. So there's specific criteria that you need to have if you have fibromyalgia. Myth number three is that fibromyalgia only affects women. And it's a little bit misleading. It's true that between 75 and 90% of the people diagnosed with this disorder are women, according to the National Fibromyalgia Association. However, men can also be affected with it as well. So there is some debate regarding the accuracy of diagnosis among men, as they're less likely to seek medical care, and gender-based bias, I guess, may play a role on how doctors diagnose fibromyalgia, but it certainly can impact men as well, although greater impact is the number of women. So myth number four, there's nothing that you can do. So where there's no cure for fibromyalgia and medication doesn't work for everyone, there's still such a wide range of options available to alleviate some of the symptoms that come along with it. Okay, so now that I've debunked those, let's get down to what we know about fibro and some other things that you can do with it. So let's look at some diagnosis factors. So according to the American College of Rheumatology, fibromyalgia is diagnosed based on the following factors. So if you have multiple painful areas of your body, also based, this is both sides, above and below the waist. If you have additional symptoms like fatigue, poor sleep, difficulty thinking or concentrating, if you have symptoms that last for at least 3 months and no other apparent cause for the symptoms, right? So there was no injury, then you may fall under the umbrella of fibromyalgia. Let it be known there is no magic pill for fibro. So unfortunately, you cannot take a pill to make fibromyalgia symptoms disappear. So in fact, drug treatments don't work very well for many people with fibromyalgia. So, I talk to people all the time. They're like, I'm trying everything. And nothing's working, right? Well, when they say they're trying everything, they mean they're trying every pill that's being thrown at them and nothing's working. And that's common with fibromyalgia. So if you're the 1 in 4 that medications will diminish, not alleviate entirely. So 1 in 4 people, medications somewhat kind of sort of work, okay? Then you are most likely also, you've incorporated other lifestyle measures within your life, okay? Things like exercise, stress reduction, good sleep habits, cognitive behavioral therapy even has been shown to work as part of your treatment plan, okay? So I always talk about this pyramid of health and wellness, right? Where nutrition is the foundation, exercise, sleep and stress management, toxic load reduction, and then just really leading a proactive lifestyle when it comes to your health, okay? So let's talk about some of the pain management techniques that you may have tried, okay? So while many think fibromyalgia and even arthritis are the same, they're in fact 2 completely different conditions that actually have very little in common. So other than the fact that with both you're feeling pain and fatigue, okay? But many kind of put them under the same umbrella. So I want to kind of ditch that as well. Unlike arthritis, fibromyalgia doesn't primarily affect your joints. So it affects muscles and soft tissue, nor is fibromyalgia characterized by inflammation. So in fibromyalgia patients, inflammation markers are absolutely normal. So there's very little inflammation. Instead of the pain coming from an inflamed area of the body, in fibromyalgia, the central nervous system is the main signal within your brain. Okay, so arthritis, inflammation of your joints. Fibromyalgia, that's not it, okay? So maybe you've been saying I have fibro and it's actually arthritis. So know which one you're dealing with, right? Know your demon so that you can approach it properly. Here's what we do know, okay? So while there's much is still really misunderstood about fibromyalgia, there's still a ton that we do know. So the following factors suggest that you're more likely to get fibromyalgia. Like I mentioned, if you're a woman, 75 to 90% of patients with fibro are women. You have another painful disease such as arthritis or an infection. You have a mood disorder like anxiety or depression. You are physically or emotionally abused or have PTSD. If you rarely exercise or have other family members who have it. So if you have any of those markers, even if you're watching this for somebody else, but you have those markers, take caution, okay? But like I said, this isn't all in your head. The pain is real. So while doctors aren't sure what causes this condition, the symptoms are very real. And if you know anybody with fibromyalgia, they will absolutely let you know the symptoms that come along with it, right? Symptoms include muscle pain, burning, twitching, tightness, lower pain threshold and tender points, draining fatigue, like fatigue taken up a notch, really having a hard time concentrating, remembering. It's also called, it's known as fibro fog, insomnia, so not sleeping well, feeling nervous, worried, depressed, are all common symptoms. Simply put, you ache all over. And fibromyalgia can feel similar to osteoarthritis, bursitis, tendinitis, but rather than hurting in a specific area, the pain and stiffness just is everywhere throughout your body. So additional symptoms can include belly pain, bloating, queasiness, constipation, diarrhea, or if you have, you may have got the irritable bowel syndrome blanket diagnosis put on you with fibro, headaches, dry mouth, nose, and eyes, sensitivity to cold, heat, light, or sound, urinating more often, numbness or tingling in your face, your arms, your hands, your legs, your feet. But know which of these sensations is biggest for you. There are many medical conditions that are commonly linked to fibromyalgia. So let's take it a step beyond fibro. And while people with fibro are more likely than others in the general population to have other chronic disease, doctors, again, have yet to figure out why. So we're doing all the research, but we haven't figured out why this happens. And it's so essential for people with fibro to have an understanding of the associated conditions and other symptoms in order to control pain better and really just to improve overall health. So people living with fibro will often have other things like migraines, autoimmune disease, irritable bowel syndrome, depression, anxiety, sleep disturbances. And having multiple overlapping conditions isn't easy, and it actually increases pain and your suffering that comes along with it. So if anybody's been diagnosed with a coexisting condition with this, you are not alone. There are actually a lot of scientific findings and prevalence of coexisting conditions. So like migraines, for example, and I'll post a link to for all my research geeks out there. If you want to see any of the research linked, there was a study in 2011 that was published from the Journal of Headaches and Pain. That's an actual journal that suggests that migraine headaches may actually trigger fibromyalgia. So you can read more on that. Same with autoimmune disease. In about 25% of cases, fibromyalgia coexists with an autoimmune condition. So according to the Center of Disease Control and Prevention, rheumatoid arthritis and lupus are among the most serious, okay? And actually, I know my mom actually has a really rare autoimmune disease. It's a rare form of pneumonia that she contracted, 20 years ago. And it came with, and then it was like rheumatoid arthritis, fibromyalgia, just like, so this is something that I've watched someone live with for 20 years. And I mean, if you're not doing some of the other things, this is where very quickly you will also experience other things like depression, anxiety, and gut issues like the irritable bowel syndrome. Actually, up to 70% of fibromyalgia patients often suffer from IBS or gut health issues, which is any digestive disorders, and also sleep disturbance. So up to 90% of fibro patients experience non-restorative sleep. So sleeping is when we do our best healing, right? And 90% of fibro patients actually aren't getting into that deep sleep state, and just not feeling like they're getting enough sleep, feeling refreshed, despite the appearance of having slept, right? A lot of people say to me, I was sleeping for 8-9 hours, but yet I don't feel like I get any sleep, right? Actually, there's a study that reports that 33% of people with fibro also have restless leg as well. So, and if that is you, I'm going to post if you look in the comments, you'll be able to see a research study here as well. Excuse me. So let's talk about the medicine of the future, okay? Functional medicine is considered the medicine of the future, okay? And this is because functional medicine utilizes what we know in conventional medicine at all of the tools, but then takes it a step further and goes beyond the symptom treatment model of care, okay, and takes it that extra step. So conventional medicine focuses only on managing symptoms through pain medications and antidepressants, okay, and if you suffer a fibro, this is probably what it's been looking like for you, right? Here's something for pain, and here's something for your depression that's coming along with it. Whereas functional medicine, on the other hand, looks to find the root cause of the fibromyalgia and other chronic diseases, and then treating the problem at the root level to restore the patient to health versus just masking the symptoms. Functional medicine looks at the body as a whole being rather than individual parts, and really utilizes the patient's lifestyle factors to determine potential causes and symptoms, and then from there can develop different treatment plans to help, individual treatment plans to help each person. The patient and the doctor are really partners when it comes to disease treatment and prevention. Okay, so that's where I'm coming from. That's where I'm looking to move you past pain management and something that's a little bit more sustainable, right? And getting you feeling better today. Okay, so for the remainder of our time together, I'd really like to share some different methods of alleviating the symptoms to preserve your wellness, right? Because being on pain medication or antidepressants, there's a place for them, right? But when you are living with something that is really a holistic issue and a lifestyle driven issue as well, it's just not sustainable, right? And I think and we're talking a lot about that right now, I think with our reliance on pain medications, opiates, we're gonna have bigger issues in the future, right? If we're not taking a step back and really going, how can I sit in a sustainable way that is sustainable for my kidneys and my liver and all of the not so sexy organs within my body that I kind of need, but that their job is to filter all of this stuff throughout, right? Eventually fibro will become the least of our issues, right? If then you're, hooked up to dialysis in 20 years from now, right? Because it wasn't dealt with appropriately now, okay? So I'm not discrediting what you've been doing. I'm just saying that there's a whole lifestyle behind this, okay? So from alternative therapies to avoiding certain foods, correcting vitamin deficiencies, and just getting out and moving, right? Even though working through the pain, getting out and moving, there's a ton of different options that are available. So my goal is to really help you to help ease the symptoms. There's not a cure for fibro. I'm not saying that this is gonna cure it. It's just it's a more sustainable method of helping you, okay? So let's get down to it. Are you getting enough of the good stuff? So as I mentioned, people diagnosed with fibro are at an increased risk of other coexisting conditions. And nutrient deficiencies are common among people living with fibromyalgia. So things like magnesium, vitamin D, B12 deficiency are all like the most common vitamin deficiencies seen in those who have been diagnosed with fibromyalgia. So blood tests can be used to measure current levels and correct the deficiencies to help reduce associated symptoms. So a magnesium deficiency, for example, is linked to muscle soreness. And because so much of our standard American diet, our SAD diet, isn't giving a lot of these things either. So once you identify the specific nutrient deficiency that you have, you can then determine whether you need to work other foods like high magnesium foods or high in vitamin D, or and supplementing properly, right? Taking it beyond just, you're gonna have to get serious about really good vitamins to supplement as well, and probiotics as well, because, and we're gonna talk gut too, okay? So because the gut is linked, and I talk about this all the time, it's where your immune system is. It's where all a lot of your hormones are stored. And leaky gut is also known as an increased intestinal, it's increased intestinal permeability. Okay, so it's a digestive condition in which the bacteria and the toxins can actually leak through your intestinal wall. So each of us is teeming with bacteria, both inside our bodies and on our skin. So when harmful bacteria outnumber the beneficial strands, we can lose our ability to digest and absorb any of the nutrients. So the use of things like antibiotics and leading, eating our standard American diet or sugar-rich diet can cause bacteria to become imbalanced, okay? Gluten and other food intolerance can also cause leaky gut and vice versa. So gluten has been linked to more than 55 diseases. Symptoms of gluten intolerance can be tricky to detect, as the majority of signs are not digestive, but rather neurological. And manifesting things like pain, cognitive impairment, sleep disturbances, behavioral issues, fatigue, depression. So if you suspect leaky gut, or if it even hasn't been on your radar, you're going to want to avoid the following foods: grains, sugars, your refined sugars, not your healthy sugars like your bananas and your blueberries, your dirty sugars, right? Your white sugar. Dairy is another really big one. And you want to incorporate more of things like bone broth, fermented foods, your omega-3 fats, and other plants like turmeric, okay? So if these aren't on your radar, and even if you're wanting to get a head start, like I mentioned, nutrition is the foundation, okay? I personally love the Lifelong Vitality Pack, and I talk about it pretty much, guys. If I'm talking about sleep or energy or pain or anything, I'm talking about nutrition, right? I'm talking about taking out the crappy foods, eating what comes from the ground, right? As much as possible, and supplementing properly. So what I love about these ones, they're plant infused, right? They're not your like low grade Centrum or like whatever other multivitamins you're taking, and I promise you will feel a difference with these. And that I'm a feeler, right? I go by what I feel. I 100% feel a difference when I have not taken my vitamins, or if I miss them, like if I'm traveling and I forget to grab them, I feel it. So the Lifelong Vitality, you have your Alpha CRS, your XE Omega, and your Microplex as well. So you get all three of them in the pack. And what they have is, one is for cellular health. So you're constantly, even just as you're watching this, your new cells are being created in your body all the time, right? So one is specifically targeted at giving you all of the things to create healthy cells within your body. The other one is all of your fish oils. And your omegas, which are really obviously not just good for your hair, your skin, your nails, but your brain, your joints, and all of those things that are lacking within our food. And then another one is actually specifically designed to be a food nutrient supplement. So because between our standard American diet and the fact that even if we are eating all whole foods, because of our climate, the way our food is grown and harvested and all that kind of stuff, it's lacking a lot of the main nutrients or vitamins and minerals that we are needing. So things that are helping our body thrive. So this is where you can, this has all your vitamins A, B, C, D, K, magnesium, all of them in it. Okay. And another other thing that I absolutely love is the probiotics. So I personally love doTERRA's probiotics. They are called PB Assist. And when you look at them, you will see that they are double encapsulated. So one capsule is there to break down within your stomach, right? And a lot of probiotics, it has to be a probiotic with a prebiotic, or else you're just creating expensive urine. It's not absorbing into your body. But the double capsule is key versus a single capsule or a liquid, because then one capsule is getting into your stomach and the other capsule is absorbing into your intestines, which is, again, often gets neglected because your stomach has so many barriers in it, your stomach acid, among other things, that are breaking down everything so that it doesn't reach your intestines, right? Where your probiotics and your prebiotic, you want to actually to hit that, right? Drinking or eating yogurt is not going to do it. There's not enough of what you're needing in there. Okay, so that's really good marketing for the dairy industry and the sugar industry, which is pretty much driving our food. But it's not serving your body. Okay, so really amp it up. If you were wanting to nail down your gut health and inflammation within your body, highly suggest doTERRA's Lifeline Vitality vitamins as well as their probiotics. If you need to get hooked up with those, just reach out and I'd be happy. You can just get them shipped right to your house. They also are going to support candida overgrowth, okay? And candida is it's a fungus or a yeast, and a tiny amount of it naturally lives within your intestines, which there's healthy amounts of yeast. When overproduced, however, candida breaks down the wall of the intestines and then penetrates into the bloodstream, causing a slew of really unpleasant symptoms. Things like brain fog, fatigue, digestive issues, and just abdominal pain, and even pain within your body. And many patients with fibromyalgia are also found to have high levels of candida, so candida overgrowth. A few contributing factors that can lead to candida overgrowth are taking excessive antibiotics. And this is where kind of the myth of you should only be on probiotics when you're taking an antibiotic kind of came from. But when you are on an antibiotic, it ruins your gut health for up to a year after taking it. So if being on an antibiotic has been part of your past, again, there's a place for it. Super grateful. As it has shown up in our lives a few times, but it's not sustainable, right? And I know people that I'm helping now that have been on a running antibiotic for like 20 years. Like I can't imagine what they're, and now are having huge symptoms and issues like fibro, right? And they're like 40, right? They're so young, and yet they're having these big issues that have been linked back to being on antibiotics for an excessive amount of time. Eating a diet that's high in sugar and refined carbs. So your dirty carbs and your dirty sugars, okay? So again, I'm not talking about your, and this is why I think that keto is helping people, like the keto diet is helping people because it says no carbs or very little, right? However, it also, you can't have things like bananas and carrots and all that kind of stuff. So if doing something like that is something you need in order to kick your high sugar refined carbs diet, you do you, right? Whatever works. Again, not sustainable, but it can help you develop some good habits. If you drink a lot of alcohol, this is going to be linked to an overgrowth in candida. You're also going to have a weak immune system. If you have a weak immune system, again, the overgrowth. If you're taking oral contraceptives, so if you were on the birth control pill, again, another topic for another time, but really look at what's in those medications. It was something that I was on, and it seemed like when I was a teenager, everybody was on birth control, not even because of sex or anything like that. It was because, it helps your skin, or it helps your flow, or it helps everything. And it's just like, when I think of the long-term effects of being on those, not serving your body, okay? And then if you have high stress levels, you're also going to have an overgrowth of candida, okay? So, and we know then candida leads to gut issues, which leads to everything else, okay? This is why when I say stress is literally killing us, this is just another example of it. So the following foods that have been shown to help fight candida. So if this is something that you're like, yep, That's me. Garlic. So garlic contains an antifungal substance, which has been shown to really act against candida or yeast, in a lot of studies. Coconut oil. Coconut oil is really high in lauric acid, which has been shown to fight candida infections and again, in multiple studies. Curcumin has been known to help with it as well. And there's lots of essential oils or plants that are really high in curcumin. Xylitol helped again against candida and decreasing the ability for it to kind of stick, and which then causes yeast infections. So if it's something that you're finding is sticking, aloe vera gel may inhibit the growth of candida in the mouth and prevent infection. So if you get something like I can't even, my mom used to get this. What is it? Thrush in your mouth. Aloe vera can help with that. Pomegranate is another one that will help. Kombucha. So this is a tea that is really rich in polyphenols and it both which has been shown to kill off candida as well. So you can buy kombucha or eating fermented foods. Probiotics, again, are another key thing that will help protect against it. But it's something you want to keep in your system, not just be on your probiotic when you are on antibiotics. Another key thing, exercise. Exercise is the single most effective treatment for fibromyalgia specifically. So according to the American College of Rheumatology, aerobic exercise such as walking, biking, swimming, other water aerobics has been shown to be particularly helpful when relieving fibromyalgia symptoms. Things like stretching, strength training are also helpful for many people. Strength training involves just the utilization of weights. So using exercise machines, exercise bands, and really focusing on specific muscles. We understand, as professionals, that it can be very difficult to motivate yourself to move when you're in pain, right? But it's kind of that catch-22, right? I don't move because I'm in pain, but I'm in more pain because I don't move, right? But regular movement, even if it's you start with walking, just going for a walk and working this in regularly will drastically reduce your pain over time, okay? And work your way up to doing different exercises. Even there's alternative exercises that you can do. So meditative movement therapies such as Tai Chi, yoga, they appear to improve fibromyalgia symptoms according to a study that was actually published in the Journal of Rheumatology. And if this is something that you are interested in, I am going to post the link to it so that you have it. So Tai Chi is it's a Chinese martial art that really focuses on achieving mental calmness through gentle, flowing, low impact physical movements. So if you are needing Tai Chi instruction, find one in your area. I know a few if you are local to where I am that I will highly recommend. Yoga is also a discipline that incorporates breathing control, simple meditation, and just the adoption of specific body postures and a wide practice of just overall health, relaxation, aka the opposite of stress, right? So if that's something that you're needing as well. And if there's any other form of movement that you guys have found that is really helpful, make sure you post them in the feed. But you will find becoming a yogi is so beneficial for you. Yoga offers just a number of benefits in addition to pain relief. So while yoga is a good and gentle way to stretch your body and loosen up tight muscles and joints, it's also really great for balance and strength as well. So when practices with traditional techniques, which emphasize the controlled breathing and awareness, yoga can also help you just relax and calm and focus on your mind, deal with any emotional turmoil that might be happening. Okay. And several reviews were actually published between 2012 and 2015 that explore the many benefits of yoga specifically for fibromyalgia patients. And the findings include that there's a small positive effect on fatigue or multiple fatigue related conditions, including fibro. Positive impacts on mindfulness activity, which, things, if you are suffering, all those other things that we talked about that can come along with fibro, such as depression, it helps to kind of go against that. Really promising results for mind-body techniques, including yoga, tai chi, Pilates, all of those exercises. There's a lot of really good findings in them. So tons of research out there. If you are saying, if you just want to take your health in your own hands, do your research, right? There's tons out there. And some poses that you might find will help you, and things that you can actually do at home. There's one actually called legs up the wall. So this pose works in the opposite direction of kind of your typical upright posture, and allows your muscles and your hips and your legs to stretch and relax. So what you do is you just lay on your back with your arms out kind of in a T, and let your legs sit up on a wall. Simple. But it does a lot for how your hips are situated. And again, focus on your breathing while you're doing that. Another one is the standing forward fold. So you can try this posture more for its calming effects, as well as for the opening. It helps with your entire back and your body. And depending on your degree of pain and flexibility, you can easily modify that one as well, right? I know a lot of people that have fibro. I know my mom would say, that's fine, you can get me laying on the ground, but good luck getting me up, sort of thing, right? But for this one, you can actually stand up tall and hinge or bend forward from your hips, place your hands, wherever they're comfortable. And for some, this may be on the floor, and for others, it may be your shins or your thighs. But the more you practice this posture, the more deeply the stretch will happen over the course of time. Okay. And another really good one is called the butterfly. And this is an excellent pose for opening up your hips, strengthening your knees and your groin area. So start with your legs extended in front of you, and then slowly bend the knees outward as you bring your feet together, and your heels are kind of pointed towards your body, and just practice that bending motion. And again, you can deepen it as you're needing it. Okay. Other natural pain relief, because pain, we've identified that only 1 in 4 fibromyalgia sufferers have medications that actually work for them. And typically it's because they've also nailed down their nutrition, their movement, their stress management, their sleep management, all that kind of stuff. And because medications aren't for everyone, they often don't work for people living with fibro, and can cause the harmful side effects that come along with it, right? So sometimes you got to kind of look at the medications and go, and God, like, is what I have, what I'm trying to treat, I'd rather have that than the side effects, right? So instead of, you can try herbs and other anti-inflammatories to help with pain relief. So some of the ones that I highly recommend, and again, I take a lot of them in a capsule every single day to help with gut health and cell health, but I know and recommend, outside of the lifelong vitality, I really recommend using the essential oils of turmeric. And you can make your own turmeric paste, and before the essential oil came out, that's what I was doing. It tastes like dirt. But I like to take an empty veggie capsule and I'll put a drop of turmeric in. Copaiba comes from a tree in Brazil. Exact same therapeutic benefits as CBD oil, but obviously less, zero risk of THC because it comes from that tree versus the hemp plant. And it's actually 3 times stronger. So I highly recommend copaiba and frankincense as well. And all of them are kind of your turmeric, your frankincense, and your copaiba are just your best bang for your buck when it comes to pain relief, inflammation, even emotional support, right? We've talked a lot about how our emotions are linked to our body energy and vice versa, right? So if you want to kind of tag team and get both of them in there, that's what I would suggest. But herbs can be used in multiple ways. I mean, you can cook with them, you can make them in a tea. I personally don't like the taste of them, so I like to use the essential oil, and just put them in a capsule. doTERRA actually has now a turmeric capsule, and the nice part about the turmeric capsule is, again, just like the probiotics, it's double encapsulated. So you've got the essential oil, which has its benefits in one capsule, and then you've got the resin of the turmeric plant in another capsule, which has its benefits as well. So I again, let me know if you need to get hooked up and try with those. I will absolutely do that for you. Another thing you should try is acupuncture. So acupuncture appears to really reduce many types of chronic pain. So it kind of stands to reason that fibromyalgia patients would find relief from it as well. So acupuncture involves the insertion of very fine needles into various steps and strategic points within the body. So acupuncture, again, it's not for everyone, but give it a few sessions and try and decide for yourself if it's something that's right for you. And even if you're not a fan of needles, this isn't needles, right? They're so fine you don't even feel them. But the insertion of the needle is thought to really improve circulation, which increases blood flow to specific areas of the body. So, I mean, I highly recommend it. Even regular massages will help that as well. Other things that I would really recommend and love to use, Deep Blue Rub. So Deep Blue has all of your best plants in it. Peppermint, wintergreen, all the good ones. And they help with not only reducing inflammation and pain, but it helps with blood flow. Right? So anything you could do to get the blood flow to the area is going to help with healing as well. So I highly recommend that. So if you guys have any questions, please feel free to post them in the feed. But thank you so much for joining me today. I hope that if this class wasn't specifically for you, that you can forward it on or tag the people in it that it will be helpful for them. Okay. And the information I think as you slowly work to incorporate it into your lifestyle, whether it is, you're starting with nutrition or working in exercise or really honing in on sleep management techniques or whatever, as you start to work those in, you'll see what I'm talking about. Okay. I can't even make this stuff up if I tried. But again, when you know better, you do better. Right. And, there is, so many benefits. And I'm reading here, Audrey, my friend who uses CBD with the THC agrees with you that copaiba works better and is longer. Absolutely. So, and that's the thing, if you know somebody that is using CBD, and again, as stoked as I am that the government is now teaching about plant-based medicine, there's just better plants out there. So nothing against CBD. I mean, it's an okay plant, and it does the trick, I guess, right? But depending on what you're using it for, I would recommend hands down copaiba, or even frankincense or turmeric. If you're using it for sleep, get out your lavender or some serenity, right? If you're using it for anxiety or depression. Like there's just better plants out there. So we will get there where, we're teaching about all plants and not just one plant. But every single one of you out there knows someone that is starting to work plant-based medicine into their life, whether, and they kind of justify it by, I have a script for my doctor on this. Nice part about these, you don't need a script, and every single one of them are legal in all countries, so you can travel with them, and you don't have to worry about any of that kind of stuff as well. So absolutely, and if you guys have any questions, Stephen, search this group for copaiba. I did a class last week on the difference between specifically copaiba and CBD oil, or even if you need help with pain or stress management, search the word sleep or stress, and there's years of content on here now, guys. So absolutely go back and watch those classes, and even when I did them, last year, the year before, you may not have been ready to hear it then, right? You might be ready now. Just rewatch it, okay? But thank you guys so much for joining me today. And if you have any questions or what references, or need to get hooked up with any of the plants that we talked about here, just let me know. I got your back. See you.